Welcome to the Omnidental Podcast.
It is so great to be here today.
We spend a lot of time on this show doing deep dives into optimization.
Right, yeah.
We talk about optimizing your sleep, your diet, your productivity. But when I was looking through the stack of research for today's deep dive, I realized we have this massive blind spot.
Oh, absolutely.
We almost never talk about the one part of your body that essentially acts as the primary gateway for, well, almost everything else.
The mouth.
The mouth, exactly. And specifically, I want to talk about a demographic that often gets completely overlooked in the whole wellness conversation.
Seniors.
Yes, seniors. We are looking at a really comprehensive guide on geriatric periodontal wellness today, alongside some pretty fascinating clinical insights from the team at Omnidental and MedSpa.
Which is based in Arlington Heights, Illinois.
Right. And what struck me immediately when going through these sources is that this isn't just about avoiding cavities.
No, not at all.
It's about survival. It's a critical piece of the puzzle for overall longevity and your quality of life as you age.
That is not an exaggeration either. I think when most people hear the phrase gum disease, they just think it's a hygiene issue.
Right, like, oh, I just need to brush more.
Exactly. But when you look at the actual physiology of aging, what actually happens to human body chemistry after 60 or 70 years, the mouth becomes this sort of canary in the coal mine for major systemic health issues.
And that's exactly what I want to dig into first, because the sources make this really bold claim that the rules of the game fundamentally change as we get older.
They do.
But, I mean, plaque is plaque, right? Bacteria is bacteria. Why is a 70-year-old at so much higher risk for gum disease than a 30-year-old? Is it really just wear and tear?
Well, it's surprisingly chemical. It's not just that the teeth themselves are older. The actual environment they live in changes.
Okay.
And the biggest villain in this story, and I use that word deliberately, is a biological change called xerostomia.
Xerostomia, which is the medical term for dry mouth, right?
Right. And I can already hear you listening to this and rolling your eyes thinking, okay, so you get thirsty, just drink some water.
It sounds like a very minor inconvenience.
It sounds minor, but biologically, saliva is basically liquid armor.
Liquid armor.
It's not just water. It is a highly complex chemical solution. It contains enzymes that actively break down food. It contains bicarbonate to buffer harmful acids. And it's packed with minerals like calcium and phosphate.
Which constantly repair your enamel.
Constantly. It's a remineralization machine. Now, what the research shows, and this is a huge point highlighted in the Omnidental Guide, is that as you age, that machine naturally slows down.
Right.
But it gets massively compounded by medication.
Oh, yeah. Saw that list in the notes. It's extensive.
It's almost everything. High blood pressure medication, antidepressants, antihistamines, diuretics.
These are standard, daily, life-saving drugs for millions of seniors.
Millions of them. But a major, major side effect across the board is that they suppress saliva production. So suddenly, you just don't have that liquid armor anymore. You don't have the acid buffer.
So the pH in your mouth drops.
Exactly. The environment becomes highly acidic. And without the physical flow of saliva to literally wash away food particles, the bacteria just set up shop.
They have a field day.
They colonize so much faster. So you have a senior who might be brushing the exact same way they have for 50 years, but suddenly the chemistry is completely working against them.
Wow.
The bacteria are winning because the primary defense system is offline.
That reframes the whole issue. It's not about being lazy with your brushing. It's about fighting a serious biological headwind.
Precisely.
And then you add the second layer that the sources mention, which is the physical, mechanical challenge of getting older.
The mobility factor.
Yeah. I mean, think about the dexterity required to floss correctly.
It's surprisingly demanding.
You have to wrap it around the finger, get the tension right, find the correct angle, go gently below the gum line without snapping it.
It requires high-level fine motor skills.
Right. And if you have arthritis,
Yeah.
or even just a mild tremor in your hands.
It becomes nearly impossible to do it effectively. And this is the real tragedy of it. You have people who desperately want to take care of their teeth, but their hands physically cannot manipulate the tools anymore.
So what happens? You leave a little bit of plaque behind.
Just a microscopic layer, that's all it takes.
And in that dry, acidic environment we just described,
That plaque calcifies. It hardens into tartar, also known as calculus, sometimes in as little as 24 to 48 hours.
Wait, it hardens that fast?
It can happen incredibly fast, and once it becomes tartar, it's like concrete.
Wow.
You cannot brush it off. You could scrub until your gums bleed, and that tartar is not moving. And worse, it acts as a rough scaffold for even more bacteria to latch onto, growing the colony and pushing deeper into the gum tissue.
Which leads us directly to the symptoms. And I feel like this is where a lot of people go into deep denial.
Oh, absolutely.
The sources list things to look out for, right?
Yeah.
Red, swollen gums, tenderness, bad breath, gum recession, maybe even loose teeth. But the one that always gets dismissed, the one people ignore because it seems mild, is the bleeding.
The pink in the sink.
Exactly. People spit, see blood, and think, oh, I just brushed too hard today.
Let's be very, very clear about this. Healthy tissue does not bleed when you touch it.
Right.
If you washed your hands and your palms started bleeding, you would go straight to the emergency room.
You would panic.
But because it happens in the mouth, we somehow normalize it. Bleeding is your body's alarm bell. It means there is active ulceration in the pocket between the tooth and the gum.
And ulceration is a heavy word. It essentially implies an open wound.
That is exactly what it is, an
Yes.
open, bleeding wound. And this is the perfect segue to the most critical, alarming takeaway from our research stack today.
The so what?
Yes, the so what? Why does it actually matter if an 80-year-old has bleeding gums?
And this is the heart connection.
It is the heart connection.
I'll admit, when I first heard about the link between gum disease and heart disease years ago, I thought it was just a loose correlation. You know, like people with generally bad health habits have bad teeth, and they also have bad hearts.
Right, a lifestyle overlap.
Exactly. But the omnidental sources, and really the broader medical research, suggest it's much more causal than that.
It is a direct biological pathway. Think about that open wound we just discussed. You have an active infection in the gum. Millions of bacteria, specifically highly inflammatory bacteria. When those gums bleed, that bacteria gets direct access to the bloodstream.
Basically a highway to the rest of the body.
Correct. And where does it travel? It goes straight to the coronary arteries. There is clinical evidence showing that oral bacteria can actually attach to the fatty plaques inside your arteries.
So they are making the existing blockages worse.
They are, and they are causing severe systemic inflammation. The body detects these oral bacteria in the heart, sends out an aggressive immune response, and your C-reactive protein levels shoot up.
Wow.
This widespread inflammation contributes directly to the hardening of the arteries, which drastically increases your risk of heart attack and stroke.
That is genuinely terrifying. But it's also, in a weird way, empowering. Because it means that by simply taking care of your mouth, you are actively doing cardiovascular maintenance. Oral health is heart health.
Precisely. That is the aha moment. If you are caring for an aging parent, or if you are a senior yourself listening to this, you have to start looking at oral care as cosmetic.
It's not about having a pretty smile anymore.
It is pure infection control. You are actively reducing the bacterial load on your heart.
Right.
And if left untreated, obviously, it leads to severe bone damage in the jaw and eventually tooth loss.
So we've clearly established the why. The chemistry changes, the physical dexterity fades, and the stakes are quite literally life and death.
Yeah.
Let's pivot to the how. The sources outline a toolkit for prevention and treatment. And I want to start with the daily defense stuff you can do right now before we talk about professional intervention.
Sounds good. Let's start at home.
We talked about dry mouth being the ultimate enemy here. The advice in the guide seems simple, but I really want to understand the mechanism. Hydration.
It all goes back to that liquid armor concept. If your body isn't producing enough saliva naturally because of those blood pressure meds or antidepressants, you have to manually replicate the effect.
So just drinking water.
Sipping water frequently throughout the day, not just for systemic hydration, but specifically to wash away the food particles and sugars. It keeps the gum tissues moist so they don't dry out, crack, and bleed.
And then brushing twice daily with fluoride toothpaste.
Non-negotiable for seniors. Because the enamel is constantly under acid attack in a dry mouth, you need that fluoride to help remineralize the surface.
It's like reinforcing the walls of the fortress while they are actively being shelled.
That is a perfect analogy.
Okay, but let's be real for a second. If someone already has that hardened tartar we talked about, that microscopic concrete, no amount of drinking water or scrubbing with fluoride is going to remove it.
No. Once it's tartar, home care is no longer enough.
This is where the professional intervention comes in. The specific procedure mentioned in the Omnidental Guide is called scaling and root planing. Now, that sounds intense. It sounds like a woodworking term or construction work.
It does sound a bit industrial, but it is essential. It is much deeper than a regular cleaning. In a standard 6-month checkup, the hygienist cleans what you can easily see above the gum line.
Right.
Scaling and root planing is a deep cleaning method that goes below the gum line.
So they're going down into those infected pockets where the bacteria are hiding.
Exactly. The scaling part of the procedure is the physical removal of that hardened tartar concrete from the actual root of the tooth, and then the planing is smoothing out the rough spots on the root surface.
Why do they need to smooth it out?
Because bacteria absolutely love rough surfaces. They need that texture to latch onto and build their colonies. By physically smoothing the root, you are making it incredibly difficult for the biofilm to reestablish itself.
Ah.
It allows the inflamed gum tissue to finally heal and naturally reattach tightly to the tooth, which closes up that bleeding pocket.
It's essentially closing the door that was left wide open to the bloodstream.
That's a great way to visualize it, yes.
Now, performing this type of procedure, and honestly, just having the diagnostic skills to catch it early before it ruins the jawbone, requires a specific kind of provider. You can't just walk into any strip mall clinic.
No, geriatric dentistry is complex.
The source material we're pulling from today specifically highlights OmniDental and MedSpa. And I want to spotlight them for a minute because their entire profile is really interesting.
They are definitely not your typical drill and fill practice.
Far from it. They are located at 305 East Rand Road in Arlington Heights, Illinois. And the practice is led by Dr. Billis Poles.
Dr. Pauls has a really fascinating background. He has over 10 years of experience, but a significant portion of that focuses on treating complex dental injuries and emergencies.
Which I think is a crucial detail for seniors. Because when things go wrong with older teeth, they tend to go wrong very fast.
Yeah, really do.
A cracked tooth, a sudden infection, severe pain. Having a doctor who specializes in trauma means they aren't going to panic when things get complicated.
Exactly. They know how to handle the high-stress situations, and if you look at their specific service area, they serve a really wide geographical footprint. They ground themselves as a regional hub.
Yeah, they list communities all over the northwest suburbs of Chicago. Places like Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, DePlain, and Elk Grove Village.
It's a huge net they cast. But what stands out to me most in their documentation isn't just the geography, it's their underlying philosophy. They explicitly call themselves patient-centered.
Which sure is a bit of a medical marketing buzzword.
It is, but they actually back it up operationally. They treat toddlers all the way up to seniors, meaning they truly understand the entire life cycle of a human tooth. They know what a tooth looks like at age 7 and how it behaves at age 77.
And they back it up with serious technology. I noticed in their service list, they utilize advanced technology for gum disease laser therapy.
Now that is an absolute game changer for the geriatric population.
Really? Why is that?
Well, traditional gum surgery for severe disease often involves scalpels, cutting the tissue, sutures, and a fairly long, painful recovery time.
Which is incredibly hard on an older body that already heals slower.
Much harder. Laser therapy, on the other hand, is remarkably precise and minimally invasive. It targets and vaporizes the diseased tissue specifically, it kills the underlying bacteria, and it actually stimulates natural healing with a fraction of the bleeding and discomfort.
Wow.
If I'm 75 years old and need deep pocket therapy, I want the laser. I absolutely do not want the scalpel.
It really shows they are investing heavily in the patient experience and precise diagnosis, rather than just doing things the old-fashioned way. They also emphasize maintaining a relaxing environment to make visits stress-free, and they note that the practice is environmentally conscious.
Which is great because, let's be honest, almost everyone has some level of anxiety about going to the dentist.
Oh, for sure.
But if you can make that environment even 10% less stressful, it lowers the barrier to entry. If you are terrified, you simply don't go. If the environment is soothing and high-tech, you might actually keep that vital appointment.
So true. Now, I want to bridge to something in their materials that completely caught me off guard at first. We spent this whole time talking about biology, bacteria, cardiovascular disease,
Right.
very heavy medical stuff.
Right.
But then I look at the comprehensive services list for OmniDental, and alongside the major dental services like root canals, Invisalign, sleep apnea appliances, and all-on-4 implants, I see a totally different category.
The med spa aspect.
Yes, the med spa services. I see Botox, I see dermal fillers, microneedling, laser hair removal, and body sculpting.
It seems like a massive pivot, doesn't it?
It does. My initial cynical reaction was, okay, are we running a serious dental clinic here, or are we running a beauty salon? But then I actually started thinking about the structural connection between teeth and the face itself.
It is entirely structural. They are intimately connected.
Walk me through that. Why does it actually make perfect clinical sense for a dentist, specifically one treating seniors who are losing teeth, to offer dermal fillers and Botox.
Think about what physically happens to your jaw when you lose teeth, or even just when you have severe untreated gum recession and bone loss. The jawbone doesn't just stay the same shape, it actually starts to resorb. It shrinks.
So the actual bony foundation of the lower face gets smaller.
Exactly. And what happens to the skin and muscle sitting on top of that foundation? It completely loses its underlying structural support.
Wow.
The lips start to curl inward, the cheeks begin to look hollow, and deep creases form around the mouth and chin. This is that classic collapsed look we traditionally associate with advanced old age. It's not just a skin issue, it's a skeletal volume issue.
So if Dr. Poles is in there restoring the teeth, maybe putting in those all-on-4 implant dentures to replace missing teeth, he's fixing the internal structure.
He is rebuilding the tent poles. But sometimes the canvas of the tent, the skin itself, has been sagging for so long that it needs structural help too. By offering dermal fillers or Botox, they aren't just doing superficial wrinkle smoothing.
They're harmonizing the soft tissue with the newly restored hard tissue.
Yes. It represents a truly modern approach. It's treating the face as one cohesive unit. Think about it. If you give a senior a brilliant, functional new set of implant teeth, but their lips are still thin and collapsed from years of bone loss, you haven't really fully restored their smile. You've only done half the engineering job.
That makes total sense when you frame it as total facial restoration. And for a senior, that aesthetic confidence piece is massive. It's not mere vanity.
Not at all.
It's about looking in the mirror and actually recognizing the person looking back at you. It's about maintaining your identity.
Absolutely. It's about dignity. It's about feeling vibrant and vital in your later years. And having all of that under one roof where the exact same medical team managing your oral infection and gum health is also expertly managing your aesthetic confidence. That is incredible continuity of care.
It really is. It's a one-stop shop for head and neck wellness, which is exactly what modern care should look like.
I completely agree.
So let's bring this all back together for the listener. We started this deep dive with the premise that gum disease in seniors is basically a silent epidemic with massive consequences.
It is a very quiet, very dangerous epidemic.
We established that aging naturally changes the rules. The body's chemistry fights against you with dry mouth, and physical hurdles like arthritis make daily maintenance a real struggle.
And we learned that the cost of ignoring these changes isn't just losing a tooth. It's systemic inflammation that directly increases your risk for heart disease and stroke.
But the incredibly good news here is that there is a clear, actionable path forward. It's a combination of aggressive daily prevention, staying highly hydrated, using fluoride, and seeking timely professional intervention like scaling and root planing to remove what you can't.
Do not wait for severe pain. That is the ultimate takeaway. Pain is a late-stage symptom.
Right. And if you happen to be in that Arlington Heights area, or if you have parents living around Buffalo Grove or Palatine, Omni Dental and Med Spa genuinely seems to be the place to go. They offer online booking, they aggressively handle dental emergencies, and they clearly understand the deep medical complexity of treating the senior patient.
And honestly, even if you are listening to this from across the country, the fundamental lesson stands. You need to find a dental provider who thinks exactly like this. Find a dentist who looks at your chart and immediately asks about your blood pressure medications.
Yes.
Find a dentist who actively talks to you about the critical connection between your bleeding gums and your heart health.
Because the old days of treating the mouth like it's completely detached from the rest of the body are officially over.
They absolutely have to be.
Now, before we sign off, I want to leave you, the listener, with one final, slightly provocative thought to mull over. We've talked extensively today about how the mouth is a window into the body, a canary in the coal mine for heart disease.
Right.
But think about the trajectory of medicine. As we start viewing the oral microbiome, the billions of bacteria living in your mouth, not just as a localized issue, but as a primary organ that dictates systemic health, the future of medicine might look completely different.
Oh, that's an interesting point.
What if, 10 years from now, the very first thing your cardiologist prescribed after a mild heart attack isn't a new blood thinner, but an aggressive, deep dental cleaning?
Wow.
What if we start treating the gums as the literal skin of your cardiovascular system? It completely changes the hierarchy of how we value medical treatments.
That is a profound way to look at it. Treating the source, not just the downstream symptoms.
Exactly.
Yeah.
Take care of the soil, not just the leaves on the tree. A huge thank you to the team at Omni Dental and MedSpa for providing the source material that powered this deep dive today. It's completely opened my eyes, and I really hope it's opened yours.
It was an absolute pleasure to unpack this research with you.
If you are local to the Arlington Heights area, absolutely go check them out. For everyone else listening, go drink a large glass of water right now. And please, floss your teeth. We will see you on the next deep dive.
Stay healthy, everyone.